is the Nurses Doing GAMSAT podcast, brought to you by Thankfully GAMSAT. We're here to teach you how to smash the GAMSAT, get into medicine, and become a flippin' great doctor. Hello and welcome to this week's episode of Nurses Doing GAMSAT. We are super excited. I'm joined here by Bhakti Sharma. She is our CASPer expert, interview expert, all things applications expert. Welcome.
Thank you. So excited to be here again.
Yeah, I was going to say again. It's not like we don't know
Again.
you.
Yeah.
We've even got our matching merch on. So if you can't see the video, we've got our little we're repping today. It's very exciting.
The brand.
So today we're going to talk about all things CASPer. Yeah. So
Yeah.
I thought we'll try and keep it a little bit conversational. We'll talk a little bit about what is CASPer and stuff. And then if we have time at the end, would you be able to give us maybe a few tips and tricks and hints and things that we can actually do to start studying?
Yeah, absolutely.
Amazing. So let's actually just start with what the hell is CASPer? What is it? Why do we have it? Tell us all the things.
Yeah, great question. I've been getting that a lot. If you've been chatting to us on the social medias, I'm the one responding. And I've been getting so many questions about the CASPer. I love the CASPer. I think it's so fun. It's basically a situational judgment test. So if you go onto the Acuity website and you sign up for the CASPer, that's what they'll tell you as well. It's a situational judgment test.
What does that mean?
I know. It's it's just random bunch of words, right? But the way that I think about it is it's an interview before the interview to kind of funnel down and get high quality applicants to sit the actual interview. It's a lot of interviews there.
I kind of feel like there's going to be a lot of people who are maybe a bit introverted, maybe feel like diagnosed or undiagnosed, a bit on the spectrum, that are going to freak out just by hearing that.
Yeah, absolutely. And to comfort all of those people, I'm pretty introverted as well, so I get it. I totally get it. But the thing is that those interviews, I don't know, you might not like it, you might like it. They're totally online. So you're not talking to anyone. It's just recorded and then you upload it and then it sends it off to the people that are meant to mark it. And also, I think with practice, which we'll talk about towards the middle end of today, you can actually develop that skill of being able to talk to the camera because it feels a bit unnatural sometimes, but we can build on that skill and I'll give you some tips on how to do that.
Yeah, amazing. Because I feel like it's kind of like the GAMSAT, where it's there's always two groups of people. I always get people talking about section 2 and they're like, I love that we can type. And then there's an equal amount of people that are like, I wish it was written still.
Yeah.
And then, and I feel like with CASPer, there's people that's like, oh my God, it's so great. There's no one on the other side of the screen. And then there's other people that oh my God, I wish there were people on the other side of the screen.
Yeah, exactly. And both sides are so fair, but the reality is that the whole process just sucks, right? And what we have to do is just build those skills to be able to work in the circumstances that they've given us. Because at the end of the day, when you're a doctor, you're not going to get to choose what type of patients you get or what types of teams you're in. So we're just building that skill of being adaptable in some sense as well.
Oh, I love that. It's a really good perspective shift on I'm just going to do it and I'm going to do it well. Yeah. So tell me, CASPer, why is it important? Why, even now we're talking about it, why should we be talking about it?
Yeah, absolutely. So let's start with why you need to sit the CASPer, right? So if you're applying to University of Notre Dame, Sydney, University of Notre Dame, Fremantle, and if you're applying to the University of Wollongong, that one especially, or all three of them, you need to sit the CASPer for, right? Now, for Notre Dame, Sydney and also Fremantle, the CASPer's worth 30% of your total application. So it's weighted the same as your GAMSAT and your GPA, right? So it's huge. You need to...
Can we bold that? I wish you could bold your, what you're saying, because so many people are I studied for 6 months for the GAMSAT. And then they're yeah, the CASPer, I'll just do it.
I know.
Wow.
They're all just I'm just going to wing it, but it's worth the same as your GAMSAT and your GPA. So it's just as important, I would argue. And for Wollongong, it's worth half your application because Wollongong only has a GPA and GAMSAT hurdle, right? But most of your application comes from the CASPer and then those bonus points that you have to apply for as well. So it's really important to get it right, and it's really important because if you don't do that well, or if you get an average score, there's going to be people that are getting really good scores in the CASPer test, and regardless of if you have a really high GPA, really high GAMSAT score, that CASPer isn't good enough, then you're not going to land an interview. So
Yeah.
it's really important
And
because
I
it's
think I
showing the
feel
medical.
like that's good.
Sorry.
I feel like that's good. Like
Yeah.
it's them looking at you're not a number, you're an actual human with
Yeah,
like thoughts,
absolutely.
and you can maybe not perform as well for whatever reason on the GAMSAT, but doesn't mean you're not going to be a
Absolutely.
good doctor.
Cool.
So then tell me, like, what is the CASPer? Like, what are they testing there?
Yeah. So what they're basically testing is if anyone's looked at or sat the interview before, it's similar, right? So they're testing communication skills, they're testing your empathy, they're testing your judgment in tricky situations, they're testing professional judgment, those interpersonal skills, those sorts of things. And it's important because, as you sort of said before, we love the fact that unis are looking at CASPer now because it's about medicine's a human-centered job, right? You're going to be talking to people whether you like it or not, unless you become like a autopsy pathologist or something. But you're going to be talking to people, right? So we need to build those skills, and that's what they want to see. That yes, okay, cool, you can sit down for 8 hours and get a really good GPA, but can you actually care about other people? Can you actually be empathetic? So, should we jump into the structure then of how it works?
I just think before we do that,
Yeah.
all of my allied health, my nurses, my ambos, my pharmacists, like my OT, my physios, this is where you guys thrive. Like,
Yeah.
as a nurse, you have to have communication. You have to have like empathy. You need judgment. Like, you need professional judgment. You're gonna make calls every freaking day of your life. Like, this
Yeah.
is where sometimes I hear like students saying to me like, oh my god, I hate the sciences and I'm a nurse and I didn't have to do physics and I chose not to do it, in year 12, and they feel like they're on the back step. And it's like, well, this is where you get to shine because you have the experience to be able to do this. Sometimes we need some structure around it, don't get me wrong. It's not like, oh, everybody's a natural, but you can draw on this experience that maybe others that don't have the same level of professional career or educational background has. So, like, yeah, I feel like it's just worth noting that, there's some areas of the application that actually help our allied health friends here, which is amazing.
Absolutely. I
So,
completely agree.
tell me then about the format. Like, how does it act? Like, give me the real life, how does it work?
Yeah. So you've picked a date for the CASPer. If you haven't already, go and do that now because dates are open and the latest that you can sit it is early June. So make sure that you've gone and signed up for it. But let's say you pick the date, sitting on it's sometime in May, and it's completely online. So you'll do it from home and you need your own computer. Make sure that you have a computer that works, not an iPad or a phone. You can't sit it on one of those. And basically,
At home on a computer, can I say, kick the dog out, kick the
yeah,
family out, get everybody out of the bloody house, okay?
yeah,
No one else stealing your internet at the same time. Like,
yeah, yes. It's
let's set up for success.
yeah. And if you've set the GAMSAT, you should be used to that whole thing, right? Of just like kicking everyone out and just furiously typing at your computer.
People don't. You would be surprised. Also, in the GAMSAT, some people's experiences were different. Like, we had
Yeah.
people, some of them had to sit it at 3 a.m. because that was the only time that was available. And I'm like, oh,
Yeah.
this is why you book early. So, like,
Yeah.
yeah, let's just like book as soon as you can. And like the cat, put the cat in the cage, take it to the park,
Yeah.
whatever. Like,
Yeah.
to run away, but like just out of the house.
I totally agree. And in terms of while we're on the topic of picking a date, some people have already sat the CASPer because the first date was and it's already past, it was early April. But if you haven't already started preparing, I've already kind of touched on this a little bit. Don't just wing it. Pick the latest date possible so that you have that time to be able to prepare. That's what I did. That's what I recommend to other people, because what I find that a lot of people are doing is that they're just picking the closest date because they're like, oh, I just want to like study for my exam, so I'm just going to get it over and done with, without thinking about it, without preparing, without knowing what it's about, and just winging it. And I think, yeah, pick the latest date possible. Make sure that you study for it properly. The date that's in June, some of the questions that I get about it is that it's actually after when applications close for medical schools. And I think it's an important point to make that even if you sit it afterwards, what happens is that they'll just send the results off to GEMSAT. So you don't have to worry about, oh, if I sit it afterwards, like it's not going to count. It does still count, but they'll just send it off themselves, and they'll deal with it by themselves. So you don't have to worry about that.
Jit gonna ask you that question.
Yeah.
That's important. So we're at
Yeah.
home, we're at the computer. How does it work?
Yeah. So you're sitting at your computer. Once you start the test, you've got 11 questions, right? Within those questions, you have sub questions, but 11 main questions. First four will be video response questions. So you're sitting there, you'll get a question or a prompt, or sometimes you'll watch a video of a scenario happening as well. So they're trying to immerse you into the circumstance. And then you'll get a question, and then you have to record your response to that. So some examples would be like, I think on the example test, they have a question about someone that's trying to return a toy to a toy store, and you're not allowed to accept returns, but they're like, no, but I need it for my daughter's treatment or whatever. And like you've been put in a ethical or moral sort of situation where you're trying to decide whether you help this person get enough money for their daughter's treatment or you follow the rules of where you work. So it's those sorts of circumstances where you've been put in a tricky situation where there's really no right answer, right? Like you don't want to lose your job, but also like you feel really bad letting this guy go who clearly needs help. So you have to respond to that in a video format, right? So you'll speak to the camera, you'll share what you know. You get 1 minute per question video response to answer the question, right? And one situation, so for example, that toy circumstance might have 2, 3, 4, sometimes sub questions for that. And then you'll record your answer, and then you get a break in between. And then after that, it's like a 10-minute break.
Wait. So 1 minute for all the questions or 1 minute per question?
1 minute per question. So you get 1 minute.
3 questions.
Yeah.
On that one stem. So you get 3 minutes to respond.
Yeah. Yeah.
Okay.
So you get 3 minutes, but the cutoff time is really strict. So the way that it works is it'll just have like one question, and then it'll say 1 minute to answer this question, and then it cuts off. And then you move to the next page and it has a second question, and then it gives you a minute, and then it cuts off.
So you can't see all the questions to begin with?
No.
Oh. And 1 minute doesn't feel like a lot. When you're actually in it, does it feel sufficient, or it just feels like, ah?
It depends. Look, if you're someone who waffles, it won't feel like long enough, right? Because
yeah, that's me.
Yeah, exactly. If you waffle and waffle and waffle, it doesn't feel like enough time, which is where we'll talk about this, I'm assuming, later as well. But structure is so important, and this is my biggest fear for people that just walk in and wing it. It's like you haven't practiced before, you don't know how to structure your responses, and then that 1 minute flies by, right? Like it's so quick and you have so much to say, you're trying to gather your thoughts. So structure is really important. So that's the video part, and then you get a 10-minute break between the video section and when you start the typed section. So the typed section is a bit longer. There's 7 stations for that one, I guess, stations. And again, same. So you'll get a situation, and this is a little bit different. So you'll get a whole page, and you get 3, sometimes 2 questions, or 2 or 3 questions, and you'll get 3.5 minutes to answer both questions. So you get to see both of the questions, and then there's little text boxes under the questions. 3.5 minutes to answer both. And then there's 7 of those. You can take a small break in between the 7 questions somewhere so that you can kind of take a break. But again, like you have to type super fast because it seems longer, but 3.5 minutes goes by really quickly when you're trying to answer. It's,
Yeah. Does the spelling autocorrect?
No.
And then are they scenario questions too? Like you are answering not the same, but like similar kind of circumstances, but you're just typing it in.
Yeah. Yeah, similar sort of circumstances like I've seen before. Your something about like your friend doesn't have a place to stay because she's been kicked out of her house. You want like you're welcoming her to your house, but your housemate's allergic to her dog. So like, what do you do there? Do you be a good friend? Do you be a good housemate? Things like that. So it's similar. Like all the questions are similar in the sense that they're gonna ask you about ethical circumstances, but they might ask you within like some questions about medical ethical judgment or things like that. And you're basically just typing your response to that. Yeah, again, structure is really important because if you just waffle on and on and on, if you're a talking waffler, you're probably also a typing waffler. You need structure to
Stop
be able
calling
to
me
make.
out, okay?
We need structure to be able to answer it in time because I've heard so many sad stories of like people running out of time and not being able to answer the second part or not being able to finish their response because they're just typing and typing and typing and yeah, just not performing well. And again, this is worth just as much your GAMSAT. It's really important to do well in this as well.
How do we scream that from the rooftops? Like is as important as your GAMSAT.
Yeah.
Even if it's your sixth preference that you're putting in, like it's still a preference in there, so you're
Yeah.
going to do well. So
Yeah.
then could you run through how, like, what are they looking for in the actual responses? Do they tell you? Do they not tell you?
So on the website, after they say situational judgment test, whatever that means, they'll say we're testing communication and ethics and those sorts of things, right? And broadly it makes sense, but it's the same as when like we tell people the GAMSAT's about reasoning skills and it's like how do you define that?
Yeah. What the hell does that mean?
Yeah, it's
Yeah.
like cool, got it, and then you walk away and you're like, wait, like what does that even mean?
Mm.
It's similar, right? So the underlying sort of factor that I want everyone to consider is that there's no right answer because the examples that I've given you there, if you've been kind of thinking about, like, oh, what would I respond to those? There's no right answer because there's so many different things to consider, right? That's what they're testing to see. Can you, number one, see all the different factors that affect the circumstance that you're in? And based on all of that information, can you come up with a response or think of things that you can do to affect that situation? Because I always think of it in the way that when you're in a medical team, let's say you're working in a hospital and you have to decide between like two patients, one of them getting a liver and one of them not, there's things that you'll have to consider in that, right? And it's not just, this patient is nicer than this one, or I feel like giving it to this patient. There's so many things like the family, all the different medical teams involved, the age of the patients, all their life stories and their medical histories as well. And that's what they're trying to see based on all the different information that you can get. Are you able to consider all of it and come up with a response?
Some of the things that we were talking about is like, what are they assessing? So it sounds like communication is probably a big one. And if we're going through like, it's like an interview, empathy, like you go through what are the things that they're really looking at?
They're not looking at just your response, right? Because I can sit there and put it into ChatGPT. I mean, don't do that. Don't do that.
Don't.
And just like if I was practicing, for example, put it into ChatGPT and say, give me the perfect answer to this question, right? And it just gives you something. But what they're looking at isn't, can you give me the right answer in this circumstance? What they're looking for is what things have led you to this, right? So again, that reasoning, right? It's a common theme. It comes back and back again. It's how can you justify what your response is and what actually leads, it's about your thinking, right? So if you look at all the different things that they have on their website, communication, empathy, situational judgment, things like that. What does situational judgment means? It means you're in a situation and you're able to make a judgment according to all the different factors that are affecting that situation, right? That's what it means. And empathy, communication, individually, you're like, I don't know how, like, what does this really, like, how do I build those skills? it's what you do every day, right? When your friend's broken up with her boyfriend, it's like you've got empathy in that situation. You're using active listening, that's communication, things like that, but applying those to circumstances that are really hard and using your empathetic lens to be able to sometimes realize that, yeah, there's actually no right thing that I can do here. But being able to acknowledge that and say, these are the reasons why I've decided that there's no really right thing that I can do here. But if I have to do something, then these are the things that I will do based on everything else that I know.
You know, what I love about empathy and the way that the lens that I look at it is my ability to put myself in someone else's shoes and to see from that different perspective. And so I
Mm,
always think with empathy, like, how, yes, this is how it's going to affect me, but how's it going to affect you? How's it going to affect
yeah,
the community? How's it going to affect Australia? How's it going to affect the hospital? How's it going to affect the other doctors? Like, how's it going to, and being able to actually think that through, I think that shows great empathy and
yeah,
ability to understand other people's perspectives. And sometimes I think in the world that we live in today, with all the social media and all the algorithms, it's really easy to only see your point of view. And so I think it's really valuable to be able to have the skill to sometimes listen and look at someone who has an opposing opinion or thought and actually go, why are they thinking that? How are they thinking that? How could I? You don't have to change your own opinion, but doesn't mean you
hmm,
can't understand other people's points of view. Like,
yeah,
I'm a really big Trump fan, but I could understand how somebody in a different circumstance who has a different life experience might think, I love Trump because he represents what I want or who I want to be. And so it doesn't mean I need to love him, but I
yeah,
think empathy is then going, you're not wrong, you're a bad person. It's like,
yeah,
okay, how can I look and have perspective? And it's
yeah,
really hard with algorithms that are just basically pouring things into our brains that are showing us what we want to see.
yeah, absolutely. And it's the same with AI, right? Like we were talking before, AI is just a huge yes man. They'll just say yes to whatever you want. But yeah, being able to, and I think part of like, it's not to kind of go on a tangent, but social media AI is the reason why we have so much conflict because people have just forgotten that other people also exist that have other life experiences, that have other things, that have other beliefs, and just it's so self-centered and almost narcissistic. And I think that CASPer's actually a
Good
good way
antidote.
because you don't want a narcissist as a doctor, right? Like I
No.
wouldn't want to like
I
have
wouldn't go
like
to med school with them. Like, you're in med
yeah,
school now. Like, you
yeah,
know, you get through because of your community.
yeah,
Like,
absolutely.
real talk. The people around you are gonna help you for the next 4 years of your life. You
Yeah,
want good blooded people.
yeah,
Like, you
exactly,
struck it
right?
lucky where you are, Bhakti, honestly, because you
Yeah.
got a really good group.
Yeah, absolutely. And like kind of going back to the point of um seeing other people's perspective, it's like I know we sort of if you've seen me before, you know that I'm at Notre Dame, second year medical student now. And like for example, now we're talking about like if someone's smoking and you want to kind of help them to stop, part of the way that you do that is actually listen to why are you so dependent on smoking? Why are you so dependent on alcohol? And even then, it's not about like, oh, I'm going to grab onto that information and try to convince them to do the opposite. It's just like trying to hear, like, okay, let's just chat about why is it that you want to drink or why is it that you want to smoke? And I think that's so important for CASPer as well, that it's just like the ability to listen without thinking about what to say next, right?
Ooh.
That's active listening, right? You're listening to listen instead of listening to respond. And I think if you can practice that, it'll put you in a really good spot for the CASPer.
That is a skill. That is a life skill. Look, I'm 41. I don't know how good I am at doing that, but it is so important to be able to listen. We should clip that up because
Yeah.
I think that's so important. And people think they're doing it. That's the other thing.
Yeah.
People are like, I don't do that. Yes, you do.
Yeah.
Yes, you do listen to respond, not to
Yeah.
and they know it. They know the difference, like the markers know the difference between someone who has considered all points of view and someone who is going down this one path and that's it.
Yeah, absolutely. I totally agree. And it's something you can practice in everyday life, right? Like, CASPer's not just about I'm studying for this test, I'm trying to, ace this test so I can get into medical school. It's about changing and being more reflective on your actual communication skills outside of the test as well. Because when you become a doctor, it's not just, oh, I need to memorize all of this to pass my exams. It's, I need to remember all of this so I can save someone's life later on. It's the same with the
Oh,
CASPer. It's not because you're trying to pass a test, it's so that you can be a good doctor in the future. So,
honestly, this is
yeah,
it's who you become on the journey to being a doctor that is
yeah,
important, more important than any test or any bit of knowledge that you're remembering. And I wish, like, this is the essence of Thank Flip right there.
yeah,
It's like, what sort of a doctor do you want to be? And let's
yeah,
create that in you now. So it is inevitable that you become a doctor because you are the type of doctor that is going to help people, that
yeah,
is empathetic, that can listen. With AI and all of the AI technology coming, there's one thing they can't do, and that's be a person.
yeah,
And I feel like part of CASPer is actually going, is this person like a people person? Not, you don't
yeah,
have to be an extrovert, but can you genuinely think and help people? Being a people person, being an extrovert, they're two different things. You don't need
yeah,
to be an extrovert, but you do need to want to genuinely help and be able to get to the other side of what's going on.
yeah,
It's a
absolutely.
real skill.
And honestly, like being an extrovert, sure, but it's great. You've got a good starting point, but these are skills that you can learn, right? Being a good communicator isn't about how excited are you to talk to other people. It's about can you actually compose yourself and put forth a good argument and actually articulate yourself properly. And those are things that, even the most extroverted person might not necessarily have. But if you're an introvert, which so many people in my year are introverts. So many of the people in our boot camp are introverts. So many people that I trained last year that got into med school this year are introverted as well, right? And I think it's about number one, the willingness to actually learn, and number two, putting in that time and effort to develop those skills to be able to communicate properly. So I think that's very important.
Nobody believes me when I say Dr. Tom's an introvert because he
Yeah.
presents very well. But
Yeah.
like to me, the definition of an introvert is like, do you recharge on your own? And then
Yeah.
an extrovert is, do you recharge around people? And
Yeah.
so to me, it's like he is 100% an introvert. Like his idea of a good time is sitting on the balcony with a glass of scotch, kind of just thinking about life and philosophy or reading a
Yeah.
good book, or like he is very much an introvert. But it's the skill of being able to show what, like, you're thinking behind the thinking. You
Yeah.
can be an extrovert and be an idiot. Like
Yeah.
those two things are not
Yeah.
mutually exclusive. Or you can be an introvert and you can be an extrovert as well and be very well considered and have built the skill and the strategies to be able to really succinctly answer the questions.
Yeah.
So I
Yeah.
wanted to clarify that because it's not about being happy or
Yeah.
excited. Or, I mean, there is a part of me that thinks like you can't buy enthusiasm. And I think if you're
Yeah.
ever going for any sort of job or interview or anything, you want to be excited to be there. Like
Yeah.
you don't want to be like, oh, this is such a chore. Like, let's get it
Yeah.
over with. Introvert or
Yeah.
extrovert, people like enthusiasm, but at the same
Yeah.
time, you don't need to fake it. Like,
Yeah. Yeah.
um,
Agreed.
so tell me a little bit about CASPer and where it fits into admissions. So obviously we know that it's weighted like 30% basically,
Yeah.
but tell me a little bit about like how does it actually fit in?
Yeah. Totally. So let's say that I'm the person applying to med school this year, whoever's listening is applying to med school this year, you've gotten a good GPA, you're in your last year of your undergrad, you've sat the GAMSAT, we've got a good score. So you sit the CASPer in the year that you're wanting to apply, right? It's valid for 1 year, and you can only sit it one time in a year as well. So if, let's say, you don't get in this year, you have to sit it again next year.
Or if you get a good score this year and a shit score next year, you can't use the good score.
Yeah. So you can
Okay.
only use, it's only valid for, oh, actually, I think it's valid for 2 years. I'm just going to quickly check because I think they changed it now.
I mean, they change things every year. That's the other thing.
Yeah.
What we're saying right now is valid for right now, but they
Yeah.
may change it in the future. Just as there's always little things that they change within applications for every uni, like minute little things, sometimes big chunky things like, UQ brought
Yeah.
back interviews or UC took away interviews. But like there's all these like tweaks that happen every year. So it's always really
Yeah.
important. We have something called the med school info site. So if you just go to our website, we might just link below. In the courses page, you can actually get a comparison of, it's like a tool that compares all of the information from all of the different unis, like roundabout cutoff scores for rural, domestic, is CASPer needed, what's the percentages of interviews versus CASPer versus GAMSAT, and what's the difference. You know what I love about it? Shows the difference between what's the percentage of like GAMSAT, GPA, CASPer to get an interview, and then once you've had the interview, what are the percentages, because it often changes, to actually get an offer. And that's where people go wrong, because they're like, oh, I got an interview. They don't realize then that the interview is worth 50% sometimes.
Yeah. Yeah, exactly.
Way more than the GAMSAT is even worth sometimes. So
Yeah.
we'll link it below just so that people
Yeah.
can find that easily.
And
how did you go
also,
with the
so
CASPer?
as of now, it's only valid for one admission cycle or 1
Okay.
year. So if, let's say, you sit it this year, you get a 4th quartile, which I'll kind of explain what that means in a second. And then next year you get a 1st quartile, you can't use this result or the 4th quartile to be able to apply for that year.
Tell
Now,
me about 4th quartile. Which one's the best? It sounds like 4th quartile is the best.
yeah, so 4th quartile means that you're in the top 25% of all people that sat the CASPer. So 75 to 100% of people, right? Sorry, top 20. So 75th% to 100%, right? And so it kind of goes down. 3rd quartile is 50% to 75%. 2nd quartile is 50 to 25. And then 1st quartile is 0 to 25.
We
So
don't want 1st quartile. That is not for
we
us.
don't know. That's not for us, right? But you can, there's people that have gotten in with a 2nd quartile, but like you want to consider that they've got like a rural bonus, or they've just got like an insanely high GAMSAT, insanely high GPA. So it's similar to the GAMSAT in that if you have a really good GPA, you can kind of get like a tiny little bit of a lower GAMSAT score. It all like balances out, right? But one thing that I want everyone to keep in mind is that, let's say you're applying to Notre Dame, Sydney, right? You're sitting the CASPer. Most people that get the interview will be 4th quartile applicants, right? And if you're sitting there with a 2nd quartile, you're competing against like genius communicators, people that know how to communicate. At that point, it becomes a lot more difficult to compete against those people because, again, CASPer's like a mini interview. If you do well in the CASPer, there's no like study done on this, but I feel like there's a correlation between getting a good CASPer score and doing well in the interview. So it's basically a funnel, and it's getting rid of people that aren't doing well in the CASPer. So you're really only competing with really good communicators when it comes to the interview for these universities. So it's really important that we're starting that base off now in the CASPer, which is a mini version of the interview, so that when we get to that point, we've got a foundation to be working with.
Oh, for sure. And you'd kind of be freaking out at that stage because
Yeah.
like, oh, all these great people are going to be interviewing. So yeah, we need the interview skills now. That's it. I
Yeah.
think it's as simple as that. Like we can't
Yeah.
delay. We need to make sure that we're prepared in the best possible way.
Yeah. So yeah, kind of going back to where it fits into the admission cycle. So you sit it, you can only sit it once. You get your CASPer score, and then when you apply in May, you use your GAMSAT, you use your GPA, use your CASPer score. When you apply for the CASPer, the more unis that so if you're applying postgrad, there's only 3, Sydney, Freo, and then Wollongong. You have to pay for each of those to be able to use it. So if you just pay, I think it's like $80 or $70 for the CASPer now, you pay it, you can only use it for one uni, but if you pay, I think it's 30 more for each additional uni that you wanted to use it for. They keep changing prices every year, same with the GAMSAT. Yeah, you can apply to all of the, but if you didn't pay those extra 30 for, like, let's say you only applied for Sydney, and not Fremantle and not Wollongong, then you can't use your CASPer score to apply to those universities. So when you're applying for the CASPer, make sure that if you think that, okay, I want to apply to Sydney or I want to apply to Wollongong, make sure that you pay for those as well, because otherwise you're not going to get to use your CASPer score to apply for that.
Or good one, because I think a lot of people are like, well, I don't know, I might not. Like, if you've already sat it now, or you're going to sit it before applications go through, you don't really know what your scores are, so you don't know what your order of preferences are. And just side note, we will probably do another applications podcast shortly. But if we haven't, go back to last year's application order. So the preference order that you put into GEMSAS can make or break whether you get in interview or not. So it should not, I'd highly suggest that you do not just go, well, I want to go to this place first and this place second and this place third. We want to strategically use your CASPer score, your GPA, your GAMSAT score to be able to preference order to increase the chance of you getting an interview or multiple interviews in some cases. Not just, well, I want to go to Notre Dame Fremantle first, and then I want to go to UWA, and then I want to go, because that, you'll screw yourself. Like, I feel like that's like, first most underrated thing is people understanding reasoning skills. Second most underrated thing is people understanding how to do applications. So watch this space. We'll do another, maybe you and me, we'll do it together, or we'll pull in some of our application specialists, because damn, it can make a difference.
It's so important. And to get to that point and not land an interview, it's so much more painful because you're so close, but you're so far. So don't just, it's the same with it's just like the closer people get to the end, the more they're just like, who cares, until you get to the interview. So it's really important.
The closer you get, when you drop off at any stage because you're not progressed to the next level, it is heartbreaking. Like, don't let a couple of weeks or a couple of months worth of prep get in the way, or $30 for the application. Like, don't do it, you know?
Yeah. You've already spent like 500, maybe multiples of that to sit the GAMSAT. Like, what's another thing? You'll make it back when you're a doctor.
Legit, it's like the rest of your life. And $30 is like a dinner out. Like, don't go out on the weekend, one day, stay home, watch Netflix, you know, or, you know, whatever you need to do to save. And I understand that, you know, money is money. And I certainly don't want to make light. There are people that are struggling. But this is, we're not talking about a Louis Vuitton handbag here. We are talking about something that's going to dictate the rest of your life. Like, let's invest in it. It's really an investment.
Yeah.
So we promised to talk a little bit about frameworks. Tell me a bit about why frameworks are important, what are maybe some common mistakes, and then we can run into, if we've got time, 1 or 2 frameworks to be able to help.
Yeah. So I think it's the way that I explain why frameworks are important is, if the timing of it isn't enough of a reason, like you've got a minute to talk, you need to have a structure for how you're going to respond to make sure that you are able to actually answer in time, right? But the second thing is that there's a lot to consider when it comes to CASPer responses, right? It's not just, oh, I've got this tricky circumstance, I'm just going to start talking about it. There's different layers to what you can talk about. So let's say, for example, some question that you might get either in an interview or the CASPer is something about, like, you see someone make a racial comment in, like, you know, you see a resident make a racial comment and you're in the team, and you don't feel comfortable about it, but you're just a little medical student. So what do you do, right? Something like that. And some people would be like, oh, no, it's bad to be racist. I'm going to, take a stance and, just go on about that, which is fine. It's great. It's true as well. But what they're looking for isn't, oh, yeah, Marie hates racism. Good on you. Let's get you into med school. It's more about, did you consider the fact that, a resident being racist might damage the relationship between the patient and the doctor, which might, lead on and become bigger and bigger? Or did you consider the reputation of the hospital? Did you consider the reputation of the school that you're representing? Did you consider yourself in that situation? That what am I learning from someone else? Did you consider all the other student doctors there that are standing there watching this resident be racist towards a patient? Whatever it is, right? So it's, although we subconsciously might be thinking about these things, and you probably are thinking, oh yeah, this is important. But if you don't explain it, or if you don't structure your response in a way to discuss all of those points and how they informed your response, then okay, like, sure, you did what everyone else would do and take a stance against racism, but it's like, you're not explaining your reasoning. There's no thought behind it, and that's what they're looking for. So one of the things that we teach in our CASPer Edge program is that stakeholders. So we start our response from, how does this affect me? And then go on to, how does this affect the immediate people involved in the circumstance? Then how does it affect the broader community? So we're kind of panning out to talk about how this affects all the stakeholders. And then I think that forms a really well-rounded response in the end, because you have talked about all the different people involved and how it impacts them, and structured that in a really nice package as well.
Can I make a note? Because there's going to be some people listening on audio, like a podcast. There's going to be some people watching like on Facebook or wherever. What Bhakti did with her hands is part of the structure. Because if you think about, and I'm going to explain what she did, but I want to give you the context. If you think about you sitting in front of the computer and actually doing your CASPer, no one's having like the time of their life that day. Everybody's feeling nervous. Everybody's like, holy shit, I'm going to perform. It's almost like how I imagine an Olympic athlete would feel. Like, I've trained for this day. I know I can do it. But there's still nerves there because it's the biggest race of their life, right? So nerves are fine. But what nerves does to some of us is that everything that we've trained sometimes just goes like straight out the window, like we forget, right? And so having a structure that is visually there to cue you to know what the next step is becomes important, because then you can rely on the physical cues. So what Bhakti did there was, she put her hands in like a little circle, and she's like, consider the people that were directly there, like you, the patient, the other doctor. And then she made a slightly bigger circle with her hands to represent the next layer out. And so what that is like, okay, what about the other people in the room, the other junior doctors, or, med school students, or, the cleaning staff that might have been there, or the nursing team, or the physio team. And then we're going to go one step out to maybe the unit, and your hands get bigger. Then we're going to look at the community around. So who are we all representing, and how does it affect them? So that's going to be the hospital. It's going to be the med school. It's going to be the, community group that's down the hall praying for people. It's going to be, and then one step bigger. And so what the physical hands help you to do is cue your thinking, so that you're thinking in the structured way. And when you're thinking in the structured way, you can communicate it clearer. I just wanted to make that clear, because there's some people that wouldn't have seen what you did with your hands, because they just do it in the car or whatever. And hello to our people driving in the cars. You're amazing. While I'm walking, so I never see the videos either. But I think it's important to know that's what structure is. You got to take into circumstance, what are the steps, but how are you going to be thinking on the day? You can't have notes next to you. So it's like, what am I going to use in, like, even the way that I'm using my hands? That's going to cue the other person who is reviewing your video as well. They're going to see that you're structured through your hand movements. So it's subtle things like this that can really help you on a day that we're all going to be nervous. Introvert, extrovert, whatever. You're all going to be nervous. How can you easier. This is why this is what we do within CASPer Edge,
Yeah.
which is our program. If you're interested in learning a bit more about it, we'll just link it below. It's part of our
Yeah.
applications program. So you can have a look online, see if it's for you, fantastic, join. If it's not for you, no big deal. But I think it's just important that whether it's our structure or your own structure or someone else's structure, that you've got one so you can perform when you need to. Like, really think of yourself like an athlete for the brain.
Yeah, exactly. And like even in med school, like when we're taking histories or when we're doing the OSCEs, the reason we memorize those, set histories or those scripts for the OSCEs is so that when you're nervous and when you're stressed out, it's muscle memory, right? You have something to fall back on so that you don't just sit there and you're like, because you've got a minute, you don't have time to forget anything, or you don't have time to, forget how to talk. So I think structure is, if there's anything that you take out of today, is you need structure. And if, again, you're not sure where to start with your structure, we're going to leave all of that in the show notes. You guys can have a look at that.
Yeah, CASPer Edge is probably for you. If you love structure, you need structure, we can teach it all to you.
Yeah.
Now,
Yeah.
before we wrap up, can you give me some like quick kind of prep tips? What are we going to know? What are we going to make sure we've done? Tell me.
Yeah. So, number one, I think the best place to start is after you've signed up for the CASPer, there's going to be those practice tests that they give you. Do those. I think they give you one or two. I think do those for a starting point, because I think that you can, number one, familiarize yourself with, because it's formatted in the exact same way as the CASPer on the day. So it just gives you some insight into, okay, this is what my screen's going to look like on the day. Secondly, I don't care if you're an introvert. I don't care if you're an extrovert or like, I don't know, unless you're some sort of like social media person who posts every day, practice talking to your camera, right? Because I think a lot of people will get caught up on that part specifically, that they're just like, it's so weird talking to a camera. Practice that. Record yourself and listen back to it. And see how many mistakes you're making. A lot of people just have like a bunch of filler words. Like my filler word is the word like and the word awesome. I say that so much. And it only takes me listening back to my recording that I'm like, wow, even then, like, like I've said it like 20 times in the past 20 minutes. So I think that's
This
really
is the
important.
hardest thing that anyone will do. I
Yeah.
can't edit these podcasts because I'm like, my own voice. And
Yeah.
I don't know a person that likes to listen to themselves. Like,
Yeah,
legit.
exactly.
It's horrific.
It's something you totally need to practice that. And also just, again, it'll get you comfortable with the timing. Do it under timed conditions, because if you're a waffler, then sitting there for a minute while you're trying to make a point to the camera, I think you'll see how quickly that time flies by. 60 seconds sounds like a lot, but a minute's not that long, right? Especially when you've got a bunch of things to say. So practice under timed conditions, recording yourself for these answers. Because again, it's not something that you can just walk in and be like, oh yeah, I'm just going to do it on the day and it'll be fine, because it's not, if you haven't done it before. Another thing, same with the GAMSAT, is try to improve your typing speed, because it's the same with the typed responses. 3.5 minutes for 2 questions is not a very long time. It's just over 1.5 minutes. And I think that a lot of people overestimate. It's like for the GAMSAT, you've got 30 minutes to write an essay, but you're still writing a paragraph in 1.5 minutes, or you're writing a lot of dot points in 1.5 minutes for these questions while you're trying to gather your thoughts, while you're trying to think about what to say next. And if you're missing anything, it's not enough time at all. So I think typing speed's really important. I think the most important thing here, I'm going to be honest, is just getting feedback and making sure that you are on the right track. Structure is so important. And I think that you can, just think that you'll be fine on the day, but you're nervous. It's worth just as much your GAMSAT. You're going to rock up on the day and you're not going to be in your best form, but you can try optimize yourself so that for that day, you have lots of things that you can fall back on, and you know that you have preparation that you can fall back on and trust yourself with, so that you can give your best foot forward.
You know, the way we do it in the interview bootcamp is the absolute best way, because sometimes what we do when we go, oh, my boyfriend or my mum or my cousin or, put significant other here is going to give me feedback. What they do is they don't understand the criteria as to what you want to get out of it. So they might not agree with your answer, right? And so when you're getting feedback, it is important that whoever is giving you feedback, and this is the way we do in the CASPer Edge, it's how we do it in the interview bootcamp, they are giving you feedback about your structure. They're not giving you feedback about the content of what you're saying, because that is personal. You're not gonna, your mum might go, no, you can't do that thing. That's not what I believe in. I think that, you should respect your elders, and if your elder is racist, then that's not your place to talk. And you might go, no, it is my place. I need to make sure that all people are represented, or this is part of my value system. It's not about either one of those. It is about, have I followed a structure that you can follow and you can see my point of view and that I've considered others' point of view? So not all feedback is equal. The feedback that matters is the feedback that's going to help you perform on the day, not did I say this one thing right?
Totally. Yeah.
And I wish that I could scream that from the rooftops as well, because people get the wrong feedback. I know, same thing with the essays in section 2. It's like, oh, my old English teacher is going to read it. And I'm like, do they understand that it's not an English essay? No one cares about how fluffy your language is, or, like what the structure of your essay even is. You're not marked on that in the GAMSAT. Your English teacher is going to mark on that. None of that matters. So it's the same sort of thing. We want to make sure the structure's there. I think that's super important.
I agree.
Go
on. I guess like the last thing that I was just saying is that it's the same as the GAMSAT, right? Like just sitting there, it's so hard to actually realize the mistakes that you're making and what you need to work on without someone else giving you feedback. And I think that if you can't, if you, don't know where to go, or you're not sure, just have a chat with us. And, even if you don't get, if you don't look into the CASPer Edge program, whatever it is, at least you'll get something to start from. And also, like what we've just talked about, just start by doing the practice tests. And when you listen back to your recording and you see that, oh, it wasn't actually that good, or, I don't know what structures to use, or I don't really know what I would do in this circumstance, being aware of that is so much more important than just saying, I'm too nervous to try practice, or I'm too nervous to think about what to say next, or I'm too nervous to, look at these really difficult questions. Unless you do them, you're not going to be able to improve. And part of what we go through in the CASPer Edge program is different structures, because there's not just one structure. Like the one that I talked about earlier, there's not just one thing, because there's not just one type of question. So there's lots of different responses. I think for after you've kind of recorded, while you're recording, another thing that you can do is look at different ethics, so medical ethics. The questions aren't always about medical ethics. You might get social sort of circumstances or things like that, but I think being aware of those medical ethics of like beneficence, non-maleficence, justice, those sorts of things give you good food for thought, and you can think about how these apply to the circumstances. And then also
they're another layer.
Yeah.
I mean, even just knowing what beneficence means, I mean, that's not a common word,
Yeah, it's not. It's not.
Understanding. I think, a really big hurdle I feel like people are going to have after listening to what we're saying here is, I don't want to record myself and I don't want to watch that. And if that is you, if you're listening and you're like, there is no way I'm recording myself and watching that back, or if you get through like the first 2 seconds and you're like, nope, that's not happening, you need to reach out to my team, because you need someone else to be able to do that for you and to give you that feedback. So that is you right now. CASPer Edge is for you, so that you can actually have a community and the structure so that that can still happen. Now, if you're one of the people where you can watch it yourself and do it yourself, fantastic, go for it. Not stopping you at all. I just want to make sure that it's clear that that is one of the steps. And if that is too hard, do not delay. Do not be like, I'm going to look at this later. This is going to happen later. Oh, I'm not doing mine till June. I'll tackle it then. No, now. because
Mm.
we've got one extra layer to get through with you. So the more time that we have, the better.
Exactly. Exactly. And even like when because we're running live classes every Thursday now, and the way that we structure is like, I'm not getting you to record it. I don't know if it's more nerve-wracking or less, but there's, all these people that are sitting the CASPer and they just respond live and we brainstorm together, or we'll type in the chats and say, oh, and having multiple people there actually helps you consider different perspectives as well. Because the perspective, what I get out of a CASPer question might not be what you get out of a CASPer question, might not be what Tom gets out of a CASPer question, right? So actually being able to work in a team, which is what you're going to be doing when you're a doctor, and gathering all the different pieces of information and like learning from other people is what's going to help you become a better communicator. So
Yeah.
I think it's a great place to start. Again, if you're not comfortable watching your own videos, or if you are stuck, or you're like, God, I like don't know what I can get, what I can pull more out of the CASPer. Or if you've sat the CASPer before and you didn't get a good score and you're like, I'm not sure what I can do this time, have a chat to the team, because I don't think that just doing the same thing over and over again that you did last time as well. Same with the GAMSAT, right? Doing the same thing, doing a bunch of practice questions. If that's not working for you, we need to change how you're preparing for these really important tests.
I will note that if you're not like, I love doing things in a big group of people, there's not a big group of people. It's usually under
Yeah,
10.
it's
Yeah.
not. It's under 10 people, and all of them are in the same boat as well. So it's not like, oh, like Frank here is sitting there judging everyone and saying, haha, I'm better than everyone else. You're all getting feedback from me. And the reason that I understand is because I also sat the CASPer 2 years ago, right? Like, I know what it's like. All these people are in the exact same boat. So it's not about like, oh, I'm nervous because I don't want to be worse than everyone else. Like, that's
Or
what you're there
don't.
for.
And participate or don't participate. Maybe just
Yeah.
going and watching some other people do
Yeah.
it for the first couple of weeks is going to
Yeah.
help you to get the confidence. And maybe in week 3 you actually end up doing yours live, or
Mm.
like later on. But you got to take the steps. That's the thing. Like, I often find in these kind of small group scenarios, big group is different, because I think if there's
Yeah.
like 200 people and you can't get a word in, and it's like, that's nerve wracking. Like, I totally
Yeah.
get that. I'm a
Totally.
professional speaker and I'm saying that. Like,
Yeah.
so I get it. But
Yeah.
in a small group, sometimes just being in the environment is getting you more accustomed to it and allowing you, your flowers slowly opening. That's
Yeah.
okay. It
Yeah.
doesn't have to be rushed. And so,
Totally.
yeah, that gives you, and you're like, oh, I would have said that. Whatever they said, I would have done something similar. And then you see the feedback that they got and you go, cool, well, now I know how I would change it as well.
Yeah.
Or actually, they did a much better job than I would have. Again, I know how to change it.
Yeah.
So, with all of that, how do you want to wrap up, Bhakti? Is there anything else that I haven't asked that you feel like I must make sure everybody knows this?
Let me just have a look. Talk about that.
Making sure you covered off everything that you thought that you
Yeah.
would.
Yeah. I think we've covered all the important points, and there's nothing really that we've not spoken about. But again, I think people will have lots of questions coming out of that, because
I
it's
mean, are
not.
you good if they just like DM us
Yeah,
questions or
totally. Totally.
because
Yeah, you can message us on our Instagram, because I am the one who replies to all of that. Or even if like on our Nurses Doing GAMSAT page, on our GAMSAT Greatness page, like I post a lot of tips and stuff on there. And then if you message me from there, or if you leave a comment on there, then I'll respond to that as well. Um
amazing. Yeah,
yeah.
I think my last thing if this has been helpful, let us know. We'd love to
Yeah.
hear that. Like, absolutely. Forward this to a friend who might be sitting in CASPer that you think might need it. And
Yeah.
if the our CASPer program is called CASPer Edge, is right for you, go below. We'll link through. We'd love to see you join if this is something that would be helpful. And if it's not helpful, tell us that the episode was helpful anyway, because we love to hear it.
Yeah.
And I guess that's a wrap from us. Bye for now.
Yeah. Bye.
Bye. have a cool gift for you, just for listening to the Nurses Doing GAMSAT podcast. We do some of our best work in our Facebook group called, you guessed it, Nurses Doing GAMSAT. It's free to join, and every day we're sharing actionable guides, tips and tricks, and really just how to smash the exam and get into medicine. You can join today by searching Nurses Doing GAMSAT on Facebook. Thanks for listening to another episode, and I'll see you next time.